And today we're talking about endometriosis versus PCOS, 5 signs that your period pain isn't just cramps. Have you ever had cramps that are so severe that they leave you doubling over in pain? Or are your periods all over the place and quite frankly, unpredictable? Do you ever get the feeling that something isn't just right? If so, then chances are you've been told that what you're experiencing is just cramps or that it's normal, it's just part of being a woman. But the truth of the matter is that if you are experiencing these symptoms, you might actually have a condition. You could have endometriosis or PCOS, polycystic ovary syndrome, or in rare cases, you could have both. The truth of the matter is that for many women and young girls who are of childbearing age, they experience all types of symptoms that lead to the diagnoses of endometriosis or PCOS, or actually they should lead to the diagnoses, but sometimes they are just overlooked, okay? And they're misdiagnosed or ignored completely. Let's talk about endometriosis versus PCOS. A lot of people use these terms interchangeably, or they just really don't know the difference. They think that both of them kind of mean the same thing. But they're actually 2 very different diagnoses. Now, what they have in common is that they occur in young women, childbearing age, usually between the ages of 15 and 44, and they very much are related to periods, menstrual cycles. But here's the difference. With endometriosis, it's a matter of the tissue being at the wrong place, okay? Going down the wrong road. So normally, if you are a woman and you have a uterus or a womb, then you have a uterine lining, okay? A lining inside of your womb, or endometrium. Well, with endometriosis, that lining is outside of the womb, okay? It's on other tissues. It can be on your fallopian tubes, it can be on your ovaries, it can be on your intestines. And here's the issue. For most women, when they have menstrual cycles, they will at some point develop some degree of pain, some degree of cramps or inflammation. Well, if this endometrial tissue, this uterine lining, is now also outside of the uterus, then not only during your menstrual cycle will you experience a little inflammation, a little pain inside of the womb, well, now you'll experience it wherever this endometrial tissue is. So it could be in your intestines, on your gallbladder, your appendix, your fallopian tube. It can be all over your abdomen. And you don't necessarily only experience the pain and inflammation during menstrual cycles. You might experience the pain throughout. And it might be very intense and irregular. So that's endometriosis. The uterine lining is not only inside of the uterus, but it's outside on other tissues causing inflammation and scarring. Now, when we're talking about PCOS, polycystic ovary syndrome, we're talking about a hormonal imbalance. Women with PCOS have abnormally high levels of androgens or testosterone, and this can lead to an abnormal ovulation. So normally when women ovulate, the ovary will release an egg, and if the egg is not fertilized, then a menstruation will occur. Okay, that's when you get the period. With PCOS, there is an abnormality in ovulation, and oftentimes women develop multiple ovarian cysts. And with this PCOS, this polycystic ovary syndrome, women will often get insulin insensitivity, so that increases the risk for diabetes. Women will develop hair in places where it doesn't typically grow on women, such as facial hair or chest hair. Women with PCOS can also lose hair on their heads where typically women want the hair to grow. And with both conditions, endometriosis and PCOS, women will often have problems with fertility, okay? These conditions can both lead to infertility. With PCOS, you can definitely experience some cramping and some pain, but the severe pain is more closely associated with endometriosis. So now let's break down the signs and symptoms. I'm going to give you 5 signs and symptoms that might lead you to a diagnosis of endometriosis, and I'm going to give you 5 signs and symptoms that might make you lean more towards PCOS. It's very important to always consult with your physician, consult with your OBGYN, okay, your gynecologist, in order to be sure that you have the correct diagnosis. And we'll talk about some of the tests and the blood work that might help you to make sure that you have the correct diagnosis, which can lead to the correct treatment. Let's start with endometriosis. Here are 5 signs and symptoms that your pain could be endometriosis. And remember, endometriosis is when the tissue is in the wrong place. It's when the uterine lining is outside of the uterus or outside of the womb and on other tissues, causing chronic pain and inflammation. Number 1, severe menstrual cramps. And I'm talking about debilitating pain, severe cramps, to the point where routine over-the-counter medications like ibuprofen and acetaminophen, the routine meds typically don't work. I have seen a lot of patients with endometriosis because when they start taking ibuprofen in particular, and NSAID, nonsteroidal anti-inflammatory drug at doses that are way above what's recommended. When you have severe menstrual cramps from endometrial pain and you're taking really, really high doses of NSAIDs, it can actually lead to CKD or chronic kidney disease. Yeah, it's really that serious. Number two, chronic pelvic pain. So we're talking about pain in the lower abdomen or even the lower back. And this pain is not just pain that occurs during your actual menstrual cycle. It doesn't just occur every month, every 28 days. We're talking about pain that is continuous because, again, when you have endometriosis, you have that endometrial material, that uterine lining that's all over the abdomen. I mean, it could be anywhere on any organ. It could be on your bladder. It could be on your large intestine, small intestines, appendix, wherever. And so you chronically have inflammation everywhere, and it can definitely lead to chronic pelvic pain. Number three, pain during or after intercourse. Now, you know that's no fun at all, but it's true. With endometriosis and all of the pelvic inflammation, then penetration can cause you pain, or even after you've had intercourse, you can be sitting there in severe pain. And this can really be devastating to women and to couples because, of course, if intercourse is causing you pain, then you're not necessarily going to look forward to having intercourse, which really could severely disrupt your relationship. And so you have a lot of psychological components that are now combined with the endometriosis. Number four, painful bowel movements or urination. This can oftentimes be worse during periods, but with endometriosis, it can be something that's chronic. So imagine this. If you have this uterine lining, this endometrial material that is on your bowels, then of course, it can cause bowel inflammation or intestinal inflammation. And so that can cause you to have pain when you try to defecate. And then we know that the uterus is right by the bladder. And if you get endometrial material, uterine lining on your bladder, then again, you can have inflammation. And so when the bladder contracts, that can cause you to have pain during urination. This is what can happen from the pain. If you have pain during urination, then you might, whether it's consciously or subconsciously, try to hold your urine. And we know that if you hold your urine and if that urine stays static and you get urinary stasis, that can lead to bacterial infections or UTIs, urinary tract infections. If you get urinary tract infections and they ascend, if they go up from your bladder into your kidneys, that can cause recurrent kidney infections or pyelonephritis. And of course, I am a board certified kidney doctor, and I can tell you firsthand that recurrent kidney infections can lead to kidney failure. So again, something that starts off as endometriosis, a female problem, can lead to kidney failure. And now let's talk about the bowel. If you have bowel inflammation and it becomes painful to have bowel movements, then again, whether you're thinking about it or it's just subconscious, then you might hold your bowel movements. Then what happens? It can lead to constipation. And if you are chronically constipated, that can lead to problems. You can have something called diverticulosis, where you actually get outpouchings between the muscles in your intestines. And basically, it can lead from go from diverticulosis to diverticulitis, where there's actually inflammation and infection. And you can even get holes in your intestines, like a perforated diverticulitis. And without getting too deep into it, you can get a serious intestinal infection, and you can get an abdominal infection, and it can become an emergency. Yes, what starts off as endometriosis can lead to an abdominal emergency. Not to mention, it's just painful and miserable. So yes, endometriosis can lead to pain during bowel movements and or urination. Number five, heavy or irregular bleeding. Yes, you can have very heavy menstruation or menorrhagia. So that's when you're having lots and lots of bleeding. Your period may last more than the typical 5 to 7 days. And even if it lasts within the 5 to 7 days, you might have an extremely heavy flow and you might pass blood clots during your periods. You can also get spotting in between periods, okay? Irregular vaginal bleeding with endometriosis. And we know that if you're bleeding excessively, it can lead to anemia. And anemia can lead to severe fatigue and even, believe it or not, put you at risk for heart disease. So these are 5 of the signs and symptoms that might lead to a diagnosis of endometriosis. And of course, if you're having problems with fertility, then that could be another hint that you have endometriosis.